Good morning, everybody, and happy Tuesday. Welcome back to your Lunch Break Live. My name is Ivana. Thank you for joining us. Today, you might notice that I'm solo here. I am not joined by anybody today, and that is because I thought with the news that worldwide coronavirus deaths have topped 1 million, and also with coronavirus likely to be a key topic in tonight's presidential debate, that today would be a good time to talk about the state of the coronavirus across Alabama. I'm going to pull up some data here in just a second from the Alabama Department of Public Health, and we're going to look at the state of COVID across the state in different counties across the state, and et cetera. So if you have any questions about your specific area, please let me know, and I will definitely hover that map over and we will look at what your county is looking like. So again, if you've got questions about your specific area, please let me know in the comments. I will be monitoring them and I will get you that information as soon as I can. So let's go ahead, let's jump in, get started. And I'm going to put this here on my screen. I know you would probably rather have this big than my face big. So I'm going to hang out over here on the side while we talk about these numbers. Now, as you can see, today, it's Tuesday, the 29th of September. Our statewide cases have topped 153,554 people. Now, those are cases. Keep in mind, the Alabama Department of Public Health recently announced they're confirming their confirmed cases with their probable cases to get that total statewide number. So you can see the breakdown that about 136,000 confirmed cases, 17,000 probable combined. If you do not remember, or if you haven't kept up with the difference in confirmed and probable, probable is the number of people who have reported having coronavirus symptoms and maybe been or have been in contact with somebody that had a positive coronavirus diagnosis, but they themselves have not gotten tested. And it is those antigen test results. Those are all put in probable. There are more healthcare providers using those antigen tests, which means that that number is getting a little bit higher as compared to the confirmed. So with those tests rising, with more providers using those antigen tests, you can see total statewide number is those two numbers combined. We got people already asking about their county. So I think what would be helpful, instead of talking about the number since March, which we know that 153,000 is a cumulative number, let's talk about the last 14 days. Now, that is the last 2 weeks here. I know we had somebody ask about Jefferson County. You can see on your screen here. I'm going to hover over. I will zoom in a little bit. If you can't see, just let me know. I will do my best to get over there. I am my own tech person here, but so you can see Jefferson County. This is the number of cases reported in the last 14 days. To be completely honest, I am not sure if those reported numbers are including confirmed and probable, or it is just confirmed. Maybe one of my producers can figure that out, or one of our reporters can let me know. But right now we are showing in the last 14 days, last 2 weeks, Jefferson County has had 224 cases. Now, the Alabama Department of Public Health is considering that a high rate. You can see this map is color coded. You can see that the lighter the county is, the quote better off that they are in the last 14 days. The less extreme their cases have been trending in the last 2 weeks. So you can see a lot of Alabama is that same color. I'll zoom out so you can see the legend. We got a little, there we go. So you can see that legend here on the side of that screen. The darker the color is, the more cases we've had in the last 2 weeks. We had some questions about Shelby County. So let me pull in here and get you Shelby County. And then again, we'll go with the counties y'all need to see. So Shelby County has got also a high rate at 299 cases reported in the last 2 weeks. That rate here is high, is being considered high by the Alabama Department of Public Health. If you need a total number for the cases in the state, last 14 days are 14,000 cases, and that is 98,000 tested. Now, let's look at we got a couple other questions here. Let's see, Mobile County, Washington County, Lee County. So let me just go ahead and jump over here. Lee, 258, you are still in that high rate. We need to note that Auburn University is in Lee County, along with the University of Alabama being in Tuscaloosa County. So we have seen those numbers continuing to stay high in those areas that have big college universities. Washington County, somebody asked, you're still in the high rate at 123, but you are on the bottom of that high rate. Now that high rate you can see is classified when you get to 100. And again, I think I misspoke earlier. That's not the exact number of cases. It's the rate of cases for the last 2 weeks. So that is my mistake there. I want to go ahead and correct that, but it's that case rate. So at 123, you're still on that low end of high, but you got to be at 100 to break down from high. So Washington County, you're getting there, but you are not there quite yet. Mobile County is at 146, still considered high. Anything above 100 is high. We've got a question for Marion about Marion County. Let me get out of Mobile County and get to Marion. Now, while I do that, we should note people have constantly been asking about Baldwin County, Mobile County, about the beaches, asking if those numbers are going to go up because people might have gone to the beaches over the past week, over the past couple of weeks over the summer, and if those cases are going to go up. But remember, these cases are calculated by the county where you live, not the county where you suspect that you caught the coronavirus. So that might not affect those southern counties as much as maybe some people believe. So right now we're at Marion County. Somebody asked, Marion County has got a very, very high rate of 296. That's high in the sense of comparing to some of our larger counties, our Mobile County, our Jefferson counties, with Marion County not having quite as big of a population as those other counties I mentioned. That is a high rate at 276. Again, that's not the number of cases for the 2 weeks that I think I said early on. That's just the rate of cases. So Marion County is high. I think we got Mary Dunn saying a lot of people fighting for their lives right now in Marion County. Got a question about Calhoun County. Calhoun County is also really high at 364. That's a high number. Calhoun County is over to the east. It is in that Cleburne, St. Clair area. Now, we've got questions about Baldwin County since Hurricane Sally, about those numbers. That's a good question. I don't know that the Alabama Department of Public Health would be able to see if there are any increases in the case numbers in Baldwin County since the hurricane. We need to remember that sometimes it takes maybe about 2 weeks to get these numbers in and to see if there was a correlation. Just recently, the Alabama officials have said, we did not see that spike they were so worried about after Labor Day. And we know Labor Day was much earlier this month, but it takes a few weeks to get that data in. So no word yet on if Hurricane Sally and people having to go to shelters or other areas has increased the rate of coronavirus in the Baldwin and Mobile County area. Good question, Robin, but we'll keep an eye on that. It's going to be a little while, I think, before we know that. Yeah, we've got people again talking about Calhoun County. I'm not sure what's happening over in Calhoun County. If you have any ideas of places where there are outbreaks and maybe why that number is spiking, please let me know. I do not know. I'm not familiar with maybe what's going on in Calhoun County. Now, we have questions too about testing. Yes, Ruth, people are still testing. You can see in the last 14 days, there have been just under 100,000 Alabamians tested. That's 98,856. So let's go back to some questions people have. Talladega County, you're still high. 234 is your rate. We had, I believe, a question about Cleburne County, which is next to that Calhoun. And again, it's 369 is the rate of cases. That's per 100,000 persons. So if you're wondering what that rate number means, so per 100,000 people, that is the rate of cases that have been reported in the last 2 weeks, in the last 14 days. Again, a little bit weird of a way to calculate that, but it keeps those numbers a little bit more on the same playing field and a little bit more relatable. That can kind of give you more of a per capita number than comparing apples to oranges, if that makes sense. If you've got questions, let me know. We've got questions about Jefferson. I'll get you back on Jefferson, Linda, and let me get some of these other counties before I circle back. Mary Green asks about Sumter County. Let me get, and also had some questions about one of these northern counties that we haven't quite talked about yet. So I'm going to go north and then I will go south. We had a question about Madison County. Madison's 195, so it's high. It is on that lower level of some of the high counties we've seen. Pretty much, again, if you use that color-coded legend and you look at this map, everything that is that dark blue color is high. You can see this legend. I know it's a little bit small on the side of your screen, but everything that is that blue color, that kind of deep blue, is in the high range. Pretty much everything that's not, might be easier to go over, is these lighter counties: Greene County, Perry County, Macon County, and our lowest rate is Wilcox County. Now, Wilcox County is in 39 is their rate of coronavirus cases per 100,000 persons in the last 2 weeks. That's good for Wilcox County. Again, Greene, Perry, and Macon are some of the counties that are in the lower areas and the lower rates of Alabama. Everybody else is trending very high. Now, I do want to switch maps for just a second and show you a kind of striking map that is a similar calculation. It's, again, the rate, which is per 100,000 persons. It's that more per capita look at the state. And these are the cumulative case numbers reported since March 11th, when we really saw this outbreak hit the United States and hit Alabama. Now, you can see this map is all one color. Again, I know that's probably kind of crazy to look at. There is a color legend on the side of that screen. So it's on the, if you don't see it, it's on the left side. Before you get to my face, it's that left side bar. And you can really see that the entire map is one color. There has not been any county in Alabama that has not been affected by coronavirus, and there has not been any county in Alabama that has not been affected to at least a rate of 1,300 persons per 100 persons, again, of cases reported since the outbreak began. We've got some people asking about the hospitalizations, the ICU. So I'm going to get you over to that area here. Excuse me while I flip through this. I don't necessarily remember what page this was on, but we do have some people asking about hospitalizations. I'll do ICU in a second, but this is hospitalizations of COVID patients. You can see that graph. We had that big spike in the summer, and we know that earlier this week, the the Medical Association of the state of Alabama, which has 5,000 member doctors, and the Alabama Hospital Association, those two groups said Governor Ivey needs to extend this mask ordinance. Our mask ordinance was enacted in mid-July. It does expire on Friday. It's set to expire Friday, and we do not have any news on whether that will be renewed or not. We're expecting that this week, but we do not have that yet. But again, Medical Association of the state of Alabama and the Alabama Hospital Association have recommended that the governor extend the mask order. Somebody in that association actually made the statement that, look, we see our numbers trending downward. We see right here on this graph, the hospitalizations trending back down after that spike in the summer and coronavirus cases. And he said that that is tied to the mask ordinance. That, again, is from a person with the Alabama Hospital Association. And again, we're waiting to see if the governor extends that order, but we should hear something this week. It is set to expire on Friday. We have got a question from Diana about number of cases and deaths by month for each county in Alabama. Diana, I do not believe that the department has that information. It might somewhere in this dashboard, and I just have not found it yet. But I will look for it. That would be extremely helpful information. But again, Diana, I'm not sure that it has there. Amy saying that my mic is picking up a loud sound with my hand. I'm sorry, it's my hand in my hair. I'm sorry for that being distracting, possibly. But Shirley's asking about Etowah County. Let me get back about Etowah. We've got questions about Walker as well. So I'm going to hop back over here. Y'all let me know if you want the last 14 days or if you want the cumulative number of cases, because we can do both. Y'all just let me know what you need to see. I know sometimes this dashboard can be really difficult to navigate. So that's why I wanted to walk you through it. We'll do it together and we will navigate this as a team here because it can be kind of intimidating. Now, the map we looked at here a minute ago, that was that last 14 days, that rate of cases. Now, this map here, this blue map, is number of cases by county reported since March. So this is that cumulative number. Again, this is a legend. So the color legend, the darker the blue is, the more coronavirus cases per county since March. This map, unlike the others, is not rate. It's not per capita. It is not per 100 persons. It is just cumulative cases. So you can see that those really dark colors is the Jefferson County, Mobile County, and I believe that's Madison County up at the top. So I've got a question that says they want the last 14 days. So let me get over to that map. Thank y'all for letting me know. I want to make sure that you get the information that you came here for and that you need. Okay, we are back on this last 14 days. And this is that, again, don't forget, this is the rate of cases, not the number of cases for the last 14 days. We had a question about Walker. Walker, you're at 277. That is the rate of coronavirus cases per 100,000 persons for the last 2 weeks. I know that's a lot of qualifying factors there, but you're at 277, so you are still considered in the high range. You got to be below, I believe it is 100. Let me zoom over. Yeah, you got to be below 100 to be not in the high region anymore. So Walker, you're at 277 per 100,000 persons. So I know Darlene was asking about Walker. I think somebody else was as well. You're still high. We got questions about Pickens and Morgan and Etowah County. So we're going to go to Morgan County. I saw it first. You're at 187. You're still high, Morgan County, but you are getting a little bit closer to that 100 number, which is where you need to be to switch out of that high category and get your county a little bit lighter blue, which on this map is what we want. So that's Morgan County, 187, you're high. Sarah, we're going to get to Etowah in just half a second, and I know Shirley wants Etowah as well. So I'll exit out of that and hit Etowah. You are at 308 Etowah. You're still in the high category. We have seen places with higher numbers, but 308 is definitely a little bit further away from that 100 mark where you need to be to get out of this high category. And Nikki, you're welcome for the information. I know if you missed it earlier, I was saying this dashboard can be very difficult to navigate. It's got a lot of information. It's very helpful that the Department of Public Health has provided that information, but it can be really hard to navigate whether you're used to looking at this kind of data or you're not. So I thought we would do it together and make sure that everybody is on the same page. Christina, did I miss Madison? Let me get you Madison, Christina. Madison's 195 high, but that is a much lower number than some of our bigger counties like Madison. The population in Madison, 195 is a good number. It's a lot lower than places that we have seen in some of these other big counties. So we want some northwest counties from Brian. Brian, you're right. I haven't gotten to that northwest corner yet. Let me go ahead and look at that. And we'll do Baldwin after we do northwest. So Lauderdale County up here in the very top northwest corner, 176. You're still high. Again, we know that high number, you got to be at 100 or lower. So we'll just make that our kind of benchmark for the moment. You need to be 100 or lower to get out of this blue coloring, this dark blue that is putting you in the high risk category. Those counties that are doing well in that aspect are Perry, Wilcox, Macon, and and Greene County. Those are the ones that are getting a little bit better in that 2-week rate period. We'll do another northwest county because Brian was interested in that. Colbert, 226. So you're higher than Lauderdale. You're still in that high range. 226 though. Take it for what you will. Franklin, also in that area, 300. So we're kind of seeing a very similar rate in this little top triangle of Lauderdale, Colbert, and Franklin. We're going to exit out there. We had questions about Baldwin. Baldwin, 276 high. I know we had some questions about, did Hurricane Sally increase those case numbers, which is a great question. Unfortunately, we do not know that right now. If you remember from the holiday weekend, like Labor Day, we knew that the Alabama officials really had to wait until there was a little bit more time for these cases to develop, to be tested, and for that data to be available to see if there was a spike. So we know Alabama officials were very happy that we avoided a Labor Day spike in cases, but at the same time, it takes a little bit of time for us to get that information. So not sure if Hurricane Sally affected these cases. Hopefully we'll know that soon. But right now, Baldwin, you're at 276. You are still in the high category. We've got a couple more people asking about their counties. I'll get you to it in just a second. Mitzi, you did not miss Bibb County. I just hadn't gotten there yet. So we'll get out of Baldwin, we'll go to Bibb, a little more central Alabama, and you're at 232, so you're still in that high. You're just kind of tuning in. This is the rate of coronavirus cases per 100,000 people. That's not the number of cases for the last 2 weeks that I think I mistakenly said earlier. It's the rate. So to get out of this high category, you need to be at 100. I say you, meaning the county, needs to be at 100, and Bibb is at 232. So we've got another question. I'm just going to go down as I see in Randolph County. Randolph County is in the eastern side, kind of central Alabama on the east, and they're at 387. So they're pretty high there, especially for their per capita, for their 100,000 persons. Again, that's kind of in the same area as the Lee County questions. We got somebody else, I think it was Cody, maybe missed our Lee County talk earlier. Lee's at 258. Again, pretty high for their per capita region, but we do know Auburn University is located in Lee County. We have seen rises in those numbers for Lee County and University of Alabama being in Tuscaloosa County. Brenda says, I have family back home in Cleburne County. How is Cleburne? Cleburne is not, they've got something going on there, Brenda. I'm not sure what it is, to be honest. I don't know if there is a source of an outbreak in that region, but that rate is 369, which is very high for that per capita number. So they're still in the high range. Brenda, I hope your family is okay. Please let us know and keep us updated on that, Brenda. We're thinking of them. Now we got questions again about Jefferson. I'll circle back to Jefferson in just a minute, Antronique. Joey has a question about people visiting patients. Joey, I'm not sure if you mean in a hospital setting. I think it depends on where you're going. If you have a family member hospitalized with COVID, you should probably call before going and make sure that you can understand it and you can get the different policies for different facilities. So that would be my suggestion there, Joey, but I'm not in the healthcare field, not totally sure about that. Let me get to Calhoun County and St. Clair County. So we've got Calhoun County being I think I went over that one a second ago. They're also in the high region because they're right there with Cleburne. So they're at 364. So they're kind of in that same very high 300 plus rate area in that eastern Alabama region. Now we've got another questions about St. Clair, a little bit lower than that Cleburne, Calhoun area. Once they got a little bit less east, a little bit more central, that rate did go down to 217. That's per 100,000 persons. That questions about Mary Dunn Kimbrell. She says, how is Alabama doing as a whole? Let's zoom out a little bit. And I'm glad you asked that because it kind of brings us back to why we're here. Alabama as a whole, since March, okay, this is a cumulative number, it's had 153,554 total cases. Now, keep in mind, Alabama Department of Public Health recently combined that total number. They've combined confirmed cases and probable cases. Probable cases are antigen test cases and these cases of people who have been in contact with a confirmed case of coronavirus, but they have not been tested themselves, but they're showing symptoms. A lot of qualifying factors there. Alabama Department of Public Health recently decided to combine those numbers. that's where you're getting that 153,000 number. Worldwide, those coronavirus deaths, excuse me, I can't say that word, have topped 1 million. Now, our deaths in Alabama are just over 2,500 at 2,517. And again, of those, they're combining these confirmed and probable deaths. There's 2,378 confirmed, 139 probable. If you need to look at the testing numbers, I know we had people asking about testing, 14,000 cases in the last 2 weeks, 98,000, a little above that, almost 99,000 tested in the last 14 days. Total hospitalizations to date, and that again is from March. So that's a cumulative number. This number is updated throughout the week. It's not updated on the weekends, and that is 17,091. Now, let's see. Antronique asked about Jefferson County. We're going to get back there. Jefferson County is 224, still in the high range. We need to be at 100 or less to get out of the high range. We got questions from Rob, and he's asking, what's the reasoning of 100 cases per capita being threshold for a high category? So, Rob, the rate is calculated per 100,000 persons, okay? So it's by the population of the county, and it's the rate of cases that are reported in the last 14 days. That's how they're doing it. I cannot tell you why. My guess would be that it was easier to compare apples to apples by saying by comparing a county with a larger population to a county with a very small population. And if they have the same coronavirus number, obviously it's a worse situation for the less populated county because they would have a higher percentage of coronavirus cases versus the big county. So I think that they're doing that to compare similar items instead of comparing totally different items. I'm not sure there's a magic number about that 100,000 persons mark, but that's just what they're using. It might have been the easiest thing to use. You are welcome, Antronique. I'll give you a couple more counties before we go here. We've got Clark, Marengo, Escambia. I'm going to keep doing the 14 days unless you want me to do something different. Y'all let me know if you want something a little bit different. Now, let's see. We are looking for Clark, Escambia, and I forgot the other one already. I'll look in a second. Clark, you're at 267. You are still in that high category. I'll give you 1 second. I feel like I've moved kind of fast through some of these. So I'll give you a second to make sure you get that number. You need to write it down. We've got, again, Escambia County and Marengo County was the other one. Marengo right here by Clark, and it's got a significantly smaller rate at 175. They're still in high, but they're just 75 above that 100 marker that makes it in the high category. And we will end on Escambia County. Let me exit out of here and find it. I'm having a little bit of a moment on finding Escambia County here. I know it is south, but I just hadn't gone south enough. That's what it is. 227, still in the high category here. We've got Jana asking, why are we focusing on the probability in tests versus hospitalization or death? Jana, we're talking about the tests here. We're not talking about probability, really, or the test. We're talking about confirmed cases in the rate of confirmed cases across the state. We do have the number of hospitalizations and deaths, just over 2,500 deaths statewide. Hospitalizations statewide not for the last 2 weeks, but since March, it's been a little bit over 17,000. So I hope this helps y'all navigate this dashboard a little bit better. If you would like for me to do this more often, please let me know. And if you need help navigating this dashboard, let me know. It's really, for especially so many of us that don't deal with data on a daily basis, it can be really intimidating. So please let me know. I'd be happy to do it again. Thank you all so much for watching. And I would say normally that I'd see you tomorrow, but I will not. I will not see you until next week. So everybody have a great rest of your week. Stay safe, and we will see you later.